Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor, available on Amazon. I'm continuing on with part 2 of surviving sepsis. And I want to remind you to please go back and watch part 1 first so that you have the full context of what I'm going to be talking about in this second part. And of course, I mentioned to like the video and, more importantly, share the video. It's important that as little as sepsis gets talked about, that we get as much information out as we can, since mainstream media doesn't cover it. So continuing on, I was unaware of what was happening, and feeling as I normally did, I continued on as if nothing was happening. And this should have been a really bad mistake from what I was told. I got so bad, according to my doctor, as the blood work confirmed via the lactate acid level test, I was septic from that septic pneumonia for over 48 hours. I should have been unalived because I hadn't gotten the necessary IV antibiotics that I needed right away. You need to understand how quickly sepsis starts and spreads. It needs a source, the original infection. Once the original infection gets too bad, and again, could be a sinus infection, could be a cut, and the body's natural immune system can't keep up. The germs and the bacteria or the toxins of the infection break loose and then enter the bloodstream. And if you remember anything about your health class in school, the bloodstream goes straight to the heart, and from the heart pumps out to the rest of the body. And imagine if you've ever seen a fire spread or a hurricane devastate a coastline in real time. Okay, this is what sepsis does, and quickly. The body continues to get overwhelmed, causing widespread inflammation throughout the body. Blood vessels get damaged and blood clots form. And once this happens, blood and oxygen get blocked, causing organs in the body to fail. And this is called septic shock. Again, this all happens really quick. Sepsis is not the infection, but rather the reaction to the initial infection, whether it be pneumonia, a cut, a bite, a cold, whatever. And understand just how common sepsis really is, yet rarely talked about. According to the CDC, nearly 2 million people every year develop sepsis. Now, to put some perspective, you remember the numbers of the COVID diagnosis, the millions and stuff? Okay, I'm going to go smaller. Okay, my cancer, Hodgkin's lymphoma, has about 50,000 new diagnoses every year. And of those diagnosed with sepsis, over 350,000 unalive. And this is a lot of unaliving. And yet, sepsis doesn't get the attention it deserves and needs. And I'll bet anything most reading this post won't know how to watch for it. Now, time, and it's an acronym, TIME, is spelled out, begins the moment the doctor suspects sepsis. By then, sepsis is already so far ahead, the patient racing towards being unalived if treatment not given soon. Bush was already not feeling well nearly a week earlier, and no time was sepsis ever suspected. Could it have been? Perhaps. But unless you specifically bring up, hey, I want to be checked for sepsis, medicine isn't going to volunteer to look for it. So I understand what happened and how to Bush. And it's sad. He was only 41 years old. And like I said, men and women, we do a lot of denying, a lot of pushing through, and depending on what is happening, can be wrong, really wrong. And it's in moments like this when it's fresh, we should be educating people on sepsis because it's more common than we realize, and the media just doesn't talk about it. A paramedic friend once told me so many people unalive from sepsis in the hospital unknowingly because it's not something the hospital checks for. And according to the AAMC, sepsis is the third leading cause of unaliving inside the hospitals. Hospitals don't assume you have sepsis or will develop it. They're waiting for symptoms. So realize that the unalive can't talk. How about those who have survived sepsis? Singer Madonna, actor Billy Porter, actress Ashley Park. Survival in the hospital when being able to treat it is 80%, but it drops rapidly without it. Now, no one with the ability and resources want to talk about it? Okay, as usual, I'm willing to do it. I always do it, one person at a time if it takes it. Always with the hope it makes a difference to at least one person watching this video. And as I said, I survived sepsis, and I know others who have, but I also know some others who have not survived sepsis. Awareness, Pneumonia 101. This by no means will be a full tutorial in learning about pneumonia and sepsis, but it will be more and easier to understand so you can better what to watch out for. Now, I already mentioned the 4 types of pneumonia and at least how you develop aspiration pneumonia. As for the others, there's community acquired, which is basically catching a virus from somebody else. Hospital acquired, which is ventilator associated, why doctors don't want you on a ventilator for that long. And healthcare associated, like in nursing homes and rehab clinics. Just as there is for recognizing a stroke, there's an acronym for helping to recognize someone with sepsis. And again, the key is you have to recognize it, not blow it off or tough it out. The acronym is TIME. T, temperature, usually really high. Okay? My rule for my history, anytime my temperature gets over 101.5, I have to go to the ER and follow this protocol. I, for infection. Now, it's tough to recognize an infection if you can't see it or if you don't feel sick. M, mental decline. Okay, I talked about the hallucinations. Okay, really crazy hallucinations. Okay, E, extremely ill. What I talked about earlier, crazy level of pain, the extreme vomiting, all that stuff. Let me tell you, the pain was ridiculous and the vomiting wouldn't stop. And I definitely saw a lot of weird stuff in my head. I was in bad shape and clearly had been for some time. This is just one of several episodes I danced a little too close with the devil. Now, Bush didn't know or suspect that he had anything more than a cold. The diagnosis of pneumonia is simple enough. Simple use of the stethoscope to hear crackling in the lungs. Sometimes you can hear with your naked ear pressed against the back of someone. And a chest x-ray will confirm pneumonia. Diagnosing sepsis, a little more complicated, and unless they're looking for it, will go overlooked. There are the tests, the CBC, which is a complete blood count, blood cultures, organ function, because your organs start to shut down when sepsis progresses. Imaging tests, and as mentioned, the lactate acid level testing. Once diagnosed, it will be only the highest broad spectrum IV antibiotics that will save a person from sepsis. And the only place to get that done is in the hospital. And no, I want to be clear, ivermectin will not treat sepsis. I can't believe that I even have to say something like that. So now you see why Bush's unaliving was really so tragic besides his age. He knew he was sick, just not how sick, and got worse rapidly. And whoever was responding to him for that medicine was also wrong. Wrong in that decision and wrong for not insisting Bush go to the hospital. When a tragedy like this hits, we need to talk about it and not wait because it's too soon to talk about, or worse, not even talk about it at all. We'll forget about Kyle Bush in probably a week or two. But understand this, sepsis can be prevented, just as strokes and other medical crises, but only if we know what to look for. Until next time, this is Paul's Heart.